Christy, let's take a moment and talk about the financial picture for technicians and pay. What trends have you observed regarding team pay over the last five years?
Well, I think what we've been seeing is that veterinary visits have been on the decline, and that's been a challenge for a lot of practices. And I think that's probably had a limiting effect on team pay and probably doctor pay as well. But we've also seen, at the same time, we've been talking about overcapacity in the profession, and that veterinarians are not being fully utilized in their doctor capacity, like Mindy was talking about, all the time. And so when it comes to paying team members what they're worth, I wonder if that overcapacity is kind of there's not the pressure on with not a busy schedule, there isn't the pressure on the doctor to delegate the technician task to the technicians, and so the doctors are doing what the technicians really should be doing. And so if a practice could really get itself leveraged to where it's training its team members to earn the practice more, whether that's gathering the ultrasound image that the doctor can then interpret, or work with the specialist to interpret. Let the technicians do the technician thing. The doctor can focus on earning more money. I wonder if that would have an increased effect on team pay.
That's a good point. One of the pieces of data we noticed was that in the Firstline career path study, they talked about it's been a while since people have had, about 50% of people say they didn't get a pay raise last year and don't expect to get one again this year. Even as we notice the financial landscape changing, do you think that we're going to see this going up and people are going to start giving raises again? Are you hearing any movement toward returning to that state of improving and giving regular raises?
Well, I think the pain factor of the challenges that we've seen with the economy and the decline in client visits is probably going to kind of separate the performing practices from the low performing, or from the underperforming practices. And so I think those that can adapt and do what it takes to be a better leveraged, better optimized, more well-run practice will probably have that ability to pay their team members more. Those that can't adapt to the current situation and find the ways to get the clients in are probably not going to survive at all.
Especially, you're talking about undercapacity, not enough visits. Yes. But the veterinarians still feel busy, and the team members feel busy too. And I've talked to a number of consultants, and they say when they go into the practices, oftentimes some of the veterinarians are doing what you described, which is instead of doing high-level things, they're doing things that other team members could do. And people feel busy, but really, a lot of times they fall into a sort of malaise. I see this happen at the front desk, where people are just like, they're a little depressed and down. That they know business is down, they know they're not going to get a raise. It all feels very depressing. And instead of kind of being proactive and taking that time, that downtime, to do more proactive things, and there's been lots of handouts and all kinds of articles written on dvm360.com that are all about what to do when you have downtime to help you build up those visits. I worry that a lot of places, it's easy to get trapped in doom and gloom. You hear about the pharmacies coming in and taking your business, and you hear about all these other things, all these competitors coming in, and it's easy to get down. But I think it hurts the whole team.